You know, all month long, we're on your side speaking with physicians with Baptist Health about February being American Heart Month and how to keep your heart healthy. It's always a good thing for that, right? And right now, we have Dr. John Eagan, a cardiologist with Baptist Health and Cardiovascular Associates in studio. How are you doing?
I'm doing very well. Thank you,
Always
Sheldon.
good to see you.
Good to see you, Sheldon.
Joining us, absolutely. And we're talking about venous disease. What is that?
Venous disease is any disease that involves the veins of the human body. Obviously, there are a lot of veins in our body. Veins take blood back to the heart. Unoxygenated blood that's been taken out, oxygen been taken out of the tissues, goes back to the heart. And those are structures are called veins, vascular structures that return blood from the body back to the heart to be pumped again.
What causes this type of disease?
Well, there's a number of things that cause venous disease. I mean, certainly whenever a vein becomes incompetent, either congenital, you're born with it, or is damaged, it will lead to something called venous insufficiency, where blood pools in a vein and doesn't return to the heart. And when blood pools in an extremity, a leg, an arm, etc., it can then cause damage to that extremity, damage to the skin and the structures within the extremity.
How is it diagnosed? I guess it's just, you can visually see that at some point, right?
Well, obviously, what we need to start with a physical exam, a good physical exam to see. You can see the effects of venous disease just by someone having swelling, skin changes, darkening, start to get varicose veins, little spider veins. So certainly by just examining a patient, you can see venous disease. And then ultimately we use imaging tests such as ultrasound to make the diagnosis.
Yeah. What kind of treatment is involved with all this?
Well, there are a number of treatments. Certainly you want to start off with prevention. You can help prevent venous disease. I mean, certainly exercise, proper diet. There are other treatments such as compression stockings that you can use to compress the veins to help the blood flow better. Ultimately, when the disease gets very severe, we have minimally invasive procedures where we can take care of, get rid of bad veins and allow the blood to circulate better.
Yeah, well, I've told you what I was diagnosed with 4 or 5 years ago. I wear those compression socks, and they do help, as a matter of fact. So I encourage you that's one place to start. Can this be fixed or reversed in any way, or how does that work really?
Well, like we say with many things in heart disease, sometimes we can get a cure, but a lot of times there's a treatment.
Right.
And the good news is there's great treatment. Sometimes people are born with congenital bad veins, and we can't necessarily cure them, but we can treat them. And certainly the things I mentioned about exercise, diet, staying away from salt, compression stockings, and then these minimally invasive procedures, they can treat the disease and we can fix it. It may reoccur, but then we can come back and treat it again.
Just real quickly, can that be in anybody, or is it just age play a factor in it? What?
Well, there are a number of risk factors, but unfortunately venous disease is more common than any other types of heart disease. Maybe 30, 40 million Americans suffer with venous disease. So it's a very common problem, but the good news is there's good treatments that we can use to help patients that suffer from this disease.
And good cardiologists like Dr. John Eagan right here. Thanks for being in here.
Thank you, Sheldon. Appreciate it.
Sharp indeed. Meanwhile, we've got plenty more coming your way. You're watching WBRC 6 News at noon. Stay with us.